As a general rule, the recommendation is that a couple should visit a fertility clinic after 12 months of frequent sexual intercourse without contraceptive protection if pregnancy has not been achieved during this period. However, in the case where the woman is over 35 years of age, it is recommended that the couple consult a fertility specialist after 6 months of trying to achieve a pregnancy. This is because age significantly impacts female fertility, leading to a decrease in both the quantity and quality of eggs. This way, a fertility assessment can be conducted for the couple, and based on the results, the most suitable treatment will be evaluated to assist them in achieving pregnancy. Additionally, it is essential to note that women who decide to take on motherhood independently, as well as female couples who wish to become mothers, should also undergo a fertility evaluation before beginning assisted reproductive therapies. This way, the specialist can recommend the most appropriate treatment.